Yeah, welcome viewers, and this is Nurse Andrea from the Andrea's Nursing Forum. And today I want to discuss one of the shift, the 73 shift. Now, as I've stated in my previous videos, you know, the different types of shift, the choices that you as a new nurse would make or should make when deciding what shift you would want to do. But the most hectic shift in all of the shifts is the 3 to 11 shift, the 73 shift in fact. Why is the 73 shift so rough? Most of the time when a patient is being transferred from the hospital into a long-term care setting, you'd find the 73 nurse is the one responsible most of the time, if you don't have a admission clerk, to do the admission process. And the admission process can be long and worn out. So you got to be on top of your game when you do the admission process. You want to make sure that when a patient is transferred from the hospital, that when the paramedics arrive, that you go and check that patient, make sure that patient is alive. Because I've heard stories of paramedics bringing patients, and when you come, the patient is already dead. So make sure the patient is alive, and you do your head-to-toe assessment on the patient. You check for, when you're doing your head-to-toe assessment, make sure you check to see the hair is okay, if there's any alopecia or anything like that, if there's any scalp issue, if there's any dermatitis in the scalp or stuff of that nature. You check the eyes to make sure there is no drainage in the eyes. The eyes are peripheral. The eyes are symmetrical in fact. You check the eyes to make sure the eyes are symmetrical. You check to see if there's any discharge from the nose, the ears. So you're doing really an ENT sort of assessment on the patient. You check dentition to make sure that the teeth is okay, or if there's any missing tooth, caries or, you know, plaque in the teeth or anything like that. You want to document, you check the status of the gum, see if there's any swelling or any bleeding coming from that mouth. You check the neck to see if there's any palpable nodes during your assessment, okay? Then you move on to the skin texture. You want your patient's skin to be warm and non-diaphoretic, which means not sweating or anything like that. Because sweating could be a lot of indication. Let's say for in case the patient is a diabetic, probably the patient his blood sugar is just, you know, wacky. So you would need to check the patient's blood sugar. So now you've done the assessment of the skin, you want to check the fingernails for the capillary refill. And you know, when you do your capillary refill on the nails, it should be less than 2 seconds. Less than 2 seconds, yes. You go on to do the lung assessment. You check to see if there's any adventitious lung songs. So you want to check the lung songs. So you're doing that with your stethoscope, you're auscultating for any abnormal breathing pattern. You want to check the abdomen. You check to see if there's any active bowel songs in all 4 of the quadrants of the patient, the right, left, lower right, and left. So you check you do that assessment, and you take your time and you do a thorough assessment on your patient. If the patient comes in with discoloration of the skin, let's say for example, the patient leaves the hospital and they had IV and blood works done, okay? And they have skin discoloration, what you want to do as a prudent nurse is to measure the length and width of that discoloration. And you have to do a documentation on your computer. You document the discoloration area. On everywhere you have a discoloration, you need to measure and document. Because, you know, you're saving yourself legality. You're saving the facility a legality. Because families could come and say, you know, hey, when the patient was in the hospital, they didn't have this bruise. So it's very important that you do a head-to-toe assessment when the patient comes in from the hospital. So you want to make sure the sex is correct, so you know what to do. You check to make sure it's the appropriate sex, okay? Because, you know, we have all different types of sexualities now, so you want to just make sure it's the correct sex that you are dealing with. You check the legs, you check range of motion, you check the toenails. It all depends on the age of the patient. Some patient might come with very thick toenails or fungus on their nails. You want to document all of that. Okay, after you turn the patient gently on the side, you check the posterior part of the patient's body to see if there's any sort of discoloration or probably bed sore or something like that. But mind you, young nurses, if you turn the patient and you realize the patient has a sacral dressing to the sacrum, you would want to uncover that dressing to see exactly what's under that dressing when you are doing your head-to-toe assessment. So now you realize the patient has a sacral dressing to the sacrum, you want to move the dressing, and if you see there's a wound, you measure the wound, and you call the doctor. Probably you might have a wound doctor. You might put in for wound evaluation, on the following day. So you call the doctor and see what treatment. If the patient has a treatment from the hospital, you resume that treatment until the patient is seen by the wound team in your facility. So now the patient is you did a thorough head-to-toe assessment of the patient. You are happy that you have done a thorough head-to-toe assessment of the patient. But you want to see if the patient is verbally responsive, alert, and responsive to person, place, time, and situation by asking the patient just a simple question, like, for example, what's your name? How old are you? Where are you? Who was the last president of the United States? Stuff like that. What color is this? So you're checking cognitive and everything, you're checking with the patient. So now that you know the patient is alert and verbally responsive to person, place, time, and situation, you check also to see if the patient has glasses, if the patient come with any eyewear, or if the patient, let's go back to the top, if the patient had any dentures. So what you have is called inventory of the personal effects of the patient. You have a sheet and you start checking off personal stuff like dentures, like cell phones, like eyeglasses, like a Bible, or clothing items. You check that on the inventory, and that's what the patient came with. So you will not be tied up with complaints from family member. So that's how a head-to-toe assessment actually is done, and I will see you again with another great video with some nursing tips on my nursing forum. This is Nurse Andrea saying have a safe day. See you again with another great video. Bye.